Okay, to begin, you're going to pick up your needle driver. Make sure you put your fourth finger inside the loop, third in this little joint, and your index right up here for some control. You're going to open and pick up your needle. Make sure to always handle it with your forceps, as touching it with your hand can be unsanitary, and also you run the risk of poking yourself. So try to adjust with the forceps. When you're holding it, try to bite down in the back third of the curve with the needle side pointing to your left and straight up at you, like a little smiley face. So to begin your actual suture, you can use your forceps to maneuver the skin however you want. Try to enter the skin or the laceration at a 90-degree angle and exit about the same. Just like that. And then as you pull through, leave about maybe an inch of a little tail left. I like to leave my needle here just somewhere where the patient won't hurt themselves, but also I remember that it's there. So that leaves about, I don't know if you can see, about an inch left. You're gonna take your needle driver, and you can do this part with your left hand either with your fingers or holding the forceps. The forceps are gonna be more sanitary, but I think it's easier to teach using your hand. So you're going to hover your forceps over your cut, and you're going to wrap the long tail around your needle driver twice. So you're going to wrap once, wrap twice, open your forceps, grab the tip of your little tail, and you're going to cross your arms to pull your suture closed. Just like that. So if you pull it too tight, you can actually rip the patient's skin if you're too tight and too close to the edge when you're throwing, or you can cause the skin to kind of pucker, which is not conducive to the best healing and the best scarring. So this is not one of a surgeon's knot, and you're actually going to have to throw 3 of these total to ensure a secure knot. So it's the same thing. You're going to wrap your long tail around your needle driver twice, open your needle driver, bite down on the little tail, and pull through. One more time. Wrap once, wrap twice, open, bite the little tail, and pull through. You'll notice that each time you tie a knot, your little tail is going to switch the side that it ends up on. And that just ensures that the knots you're tying sit flat on top of each other and don't come undone. So after you've done your surgeon's knot, which is 3 of those little knots, you can go ahead and cut the tails of your suture. When you're cutting, just think about how long a patient might want them. You want to make sure it's long enough so that it doesn't come undone, but short enough that it doesn't completely bother the patient. Yeah, and then you can keep going, separating each section you do into halves, and eventually your wound will close.